everybody. Welcome to another Mental Health Monday interview. Super happy that you guys are here. Our topic tonight is gender affirming voice training. Want to remind y'all that we do have a question queue that I am frantically remembering that I forgot just now, so I'm going to open that up. And if you have any questions, exclamation point Q, pop them into the chat with that, and then we'll make sure that we get those in there to ask our guest tonight. Our guest tonight, I am super excited to have Tallulah Breslin on with us. She specializes in gender affirming voice training. She's been guiding individuals in changing their voice gender expression since 2014 and presents locally and globally on gender inclusion, modifying voice gender expression, and voice empowerment. Many people struggle with listening to the sound of their own voice when their voice doesn't match their gender identity. And at Mantra Voice, their goal is to teach people how to feel comfortable and confident speaking so they can start living their lives as who they are. I have, of course, several different links for you guys if you're interested in finding out more about Tallulah and what she does. There's a bunch of links there: Twitter, website, couple Facebooks, and then Instagram as well. So feel free to go check those out. And with that being said, Tallulah, thank you so much for joining me today.
Yeah, thank you for having me.
What made you become interested in specializing in voice training?
So in 2014, I had a friend who was transitioning, and she wanted help with transitioning to having a more feminine voice gender presentation. And that was when I started looking into it and figuring out all the ins and outs of it. And over the last 3 years, I've had friends who were transitioning who wanted help with changing their voice gender presentation, and I helped them along the way. And as I started my own business, I just got more and more interested and active in doing the work.
That's really cool. So it was really your career was kind of driven by your friend and their experience a little bit?
Yeah, no, definitely that got me on it. I worked pre-COVID, I worked for 5 years in nursing homes, and COVID sort of, and when you're totally thrown off course, you end up finding a new path. And I started my private practice last June, and I've really enjoyed being able to go in this direction.
So you started your private practice during COVID?
I did, yes.
What was that like?
It was necessary. I think that like an object in motion stays in motion. So I'd just been staying in motion, and that sort of derailed me and came up with a new path that I really like. It took a while to get going, and I'm really happy with where I got to. But yeah, it was definitely, I needed that kick in the pants to get going, and I got there.
Yeah, that's really cool. Very neat. So what are some of your favorite hobbies aside from working and doing what you love? And do you feel that you draw any particular distinctions between hobbies and self-care?
That's a good question. I have a lot of hobbies, so it is in my same realm, but I have a lot of things I want to accomplish with getting everyone access to gender affirming voice training and doing the work well. So I have a group that I run once a month that's free. That's sort of part of my passion project so that everyone can access voice training. And then I really like getting everyone who does this work to help others with their voice to be really effective and efficient about the way they do it. So I have a group I run every other Thursday. Both of those projects are like free passion projects that I do just to help people. Then I also like doing art. So I do, right now my art projects at the moment are leather craft and watercolor painting.
Oh, okay. Those are two completely different kinds of thing there, but that's really cool. What's your favorite thing that you've made leather crafting?
Well, I like making things out of leather that looks like dragon print, so I have something here, but this is a belt that I'm working on.
Oh my gosh. Yeah, that's really cool.
Yeah, so I like making things for Ren fairs that have lots of pockets and steampunk type stuff.
That's awesome. Oh, I love Ren fairs. So I didn't go this year. I didn't go last year because of COVID. But there's Scarborough Fair. I don't know where you're from or if you're familiar with Texas, but Scarborough Fair has a really good one in Waxahachie. Well, it's like Maypearl or something. Anyway, it's fairly close to where I am. So love that one. And then the one down in Houston, TRF, is really cool too.
Yeah, there's a few. I think I actually went to the one by you. It's been a bit, but a few years ago I went to one, and I've been to TRF too. There's another one out here, Sherwood Forest, that I like a lot.
I I've heard, okay, I don't know that Bite Mark is here yet, but I'm pretty sure she's gone to Sherwood Forest. She'll correct me if I'm wrong. Whenever she gets here, I'll ask her because I think she's been there. She loves Ren Fair steampunk. Like what you just showed would be right up her alley. It would be great. She would love it. Absolutely. So what's your favorite watercolor painting that you've done?
The painting that I've done, I don't know. I tend to think of my art more about the process than the end product.
I mean,
Um,
that's fair too.
yeah, right now there's a wildflower garden near my house that I've been painting at. They have beautiful blossoms right now. That's been really nice.
Aw, that's awesome. Yeah. I mean, you got to paint what's around you, right? Kind of get that practice in too and just kind of get that expression onto paper. That's fantastic. Do you have a favorite book or genre of books?
I love science fiction books. I like Stranger in a
Mm.
Strange Land. I also like I think it's Dr. Seuss, um, Oh, the Places You'll Go. I know
Oh,
it's a
I
kid
love
book.
that book. That doesn't matter.
It's like perfect.
Yeah, absolutely. That's a good book. My 7-year-old really loves that. Well, we haven't read it in a long time. Right now, he's reading something, Super Rabbit Boy, something about, and then Zombie Goldfish also. What was the first book that you said? I'm just looking it up on Goodreads to share a link.
Stranger in a Strange Land.
Stranger in it. I haven't heard of that one.
It's an
Strangeland.
oldie.
Oh, there we go. Nice. Well, here's a link to that if anyone is interested in checking that out on Goodreads. You buy it wherever you want to buy it. So we kind of dipped into a little bit of COVID already, but the past year and 4 months have really changed things for a lot of people. And, you know, it doesn't matter what job you're doing, the world has essentially changed and in some instances stopped. So what have been some of the challenges of going virtual? And I know that you started your practice. So this is a little bit of a like, how does it compare to your previous, what you're doing previously to doing voice therapy online? And what have been some of your biggest wins and some of the biggest challenges of that?
That is a big question.
It is.
Yeah, so let me walk you a little bit through my path. So, like I said, I had been doing nursing home work, a lot of swallowing and cognitive therapy. Most of the voice work I did in nursing homes had to do with people who their volume was getting quieter from
Mm.
Parkinson's. Um, and then think about February, March is when we started to have the first impacts from COVID. And I think the beginning of June is when I left. It was hard. We went. It was full plastic gear, like um, lots of masking and plastic shields and gloves and just a lot of things. And I think it was really good for people to have speech therapy because they just
Mm-hmm.
didn't have a lot of interactions as they had before, in addition to needing the help. Um, but I did end up going a different direction, started my private practice, um, and obviously with COVID, it was going to be virtual. Maybe not like long term always the goal when I started it, but that was needed. And I worked bit by bit on getting things going, um, and getting all my tech set up and getting my business to exist. And I really like it now. I like working with people in their home because they meet me where they are. They don't have to like
Oh,
find a
yeah.
new place or interact with other people. We just like get together and work in their voice. I think finding this new area to specialize in has been really a big win for me, and seeing all the people happy with their voices is like the best win of all. Um, yeah, I mean, I love what I do now. It's really nice. So it's sort of an indirect path to get here, but I'm really happy that I did.
Yeah. Yeah, that's really cool. So do you think that you'll stay virtual? Like, is that, or are you going to open an office of sorts to kind of see some people in person, or are you liking that it's all online?
So I have seen over the course of COVID, I have had two clients in person, and I I think it works really well to be virtual. I do have a local office that I can rent from if somebody wants to do it in person, but it just actually works really well to do virtual. So I think for now, I'm going to stick with it being virtual.
That's cool. I mean, it's good for you, right? You don't have to pay for a lot of office space or anything like that, so you've got a little bit of a lower footprint. And then for people, like you were saying, being able to meet with someone in their own space, like that's one of the things that I really enjoyed about our team. So I work for an engineering firm and I'm in the sales department, and the work is completely different, unrelated, but it's nice to be able to see people in their element in their homes, and kind of the you get more of other people in a way, and it's more authentic to me this past year and year plus has been a challenge, but also, also some good things coming out of it, which is great. Oh, we have a question from the chat. Hi, Lady Lexi. Thank you so much for that question. With near constant effort, on average, about how long does it take to change one's voice to somewhere where it would be passable? That's a great question.
Yeah, I'm not sure what near constant effort means. So it's different for everybody how long it takes to change voice gender presentation. I find on average the people that I work with practice between about 30 minutes to an hour a day, and that kind of fades over time as it starts to be more using your voice in the gender presentation you're going for and practicing that way. There is no set timeline that it takes. I've had people that I've worked with once. The most I ever worked with, I had one teen who was very difficult for, and we did 55 sessions, right? Like, so that's the spectrum. And I should figure out what the average is, probably somewhere in the like 10 to 20 range, but for sessions, but I don't think there's any answer that you can predict. There's variables that can make it faster. Not smoking is a big help, and staying hydrated helps. Doing practice regularly. It can be a little harder if it's uncomfortable to practice, but it's definitely something that absolutely can be done. Again, not sure what near constant effort means though.
How does voice impact our self-identity in general?
Well, it's very core. So we use our voice to communicate all the time, every day with everyone. And if we don't like how we feel when we hear our voice, or don't like how we feel when we react to how other people gender us when they hear our voice, that has such a huge impact. It can make us avoid communicating altogether sometimes, or not speak up for ourselves, not self-advocate as much. And if you turn that around and you get to the point where your voice really rings true for you and you can be proud of your voice, that can have such a good feeling and make your communication be something that's a tool and helps you instead of a barrier.
I feel like this is not something that I, as a all the terms just went out of my head, but I was born a woman. I present as a woman. I identify as a woman. My voice sounds like a woman. Like, I feel very privileged to have that. So not having had the experience of having to change my voice to be perceived in that way. Do you find that a lot of people also are in other forms of therapy, like mental health therapy at the same time they're in voice therapy, hormonal therapy at the same time they're in voice therapy? Or is there is this part of a process that comes after those? Or is there any sort of alignment there in your experience?
So everybody's transition is different. Some people want to have help or support from a mental health provider. Most people I work with do take HRT, but not everyone. And I think that it's important to find what works best for you. You don't have to have any sort of medical intervention in order to get voice training. And it's right, we all have the same pieces and parts to our voice. So in order to change our voice gender presentation, we're learning how to modify the presentations of those, but we can do that same set of skills to change how we sound for other reasons, like to be more effective in the workplace and to be less accented or more accent, right? Like, there's all these different things that we can do with our voice. And so it's just, yeah, everyone's different. Every path is different.
Yeah, I mean, I think that's fairly, sorry, I'm just reading chat over here. I think that's a a pretty good representation of a lot of people's journeys whenever it comes to identity in general. So Lady clarified and said, I know that was a hard one. What I mean is if I try to keep my voice in the female range all the time, all day long. Sorry for the extra hard question. By the way, it was a great question. I don't think that it's, I don't think you should look at it as a hard question. It's a good question. So the near constant ever part is keeping it in the female range all the time when that is not your normal, what you've grown up with range.
So to me, I feel like, right, like I said earlier, we all have the same pieces and parts to our voice. And if we have our voice recipe now, that's what we're most comfortable and is least effortful to do. And what we do with our voice gender presentation transition is we learn a new voice recipe. Maybe we need to adjust the height of our larynx or how sweet our voice is, how light our voice is, whatever it is. And then that's going to become our norm through this process, and that becomes easy. But if we think about being in the feminine range, that just means using our preferred voice recipe, and that shift might be gradual over time, but definitely trying to use your goal voice more helps.
So practice with all other things will eventually make perfect. White Mage Fifi, thank you for being here today. They ask, what are your thoughts on voice surgery to achieve your desired gender goal?
So I would love it if voice surgery was at a place that we could recommend it, but it's just not at this point. So you, best case scenario, you get scar tissue. And the only thing that it does is it raises your pitch. And pitch is kind of an accessory variable. So if you effectively make your instrument be smaller, then your pitch goes up naturally. On average, the people that I work with change their fundamental frequency or their average pitch 35 to 70 hertz without working on pitch at all. So it's if you've done a couple of rounds of voice training with different people, so you know that you've done it as effectively as you can, and you're still not happy with your voice and you want to do voice surgery and then get more voice training afterwards, it's kind of the process. Like, that is a way to go, but I would definitely recommend everyone to try doing voice training first. I've never had anyone I've worked with go on to get voice surgery afterwards, because you just get better outcomes, and you like lose flexibility with your voice. You can't access the lower end of your range, and it doesn't give you extra range, it just raises your fundamental frequency.
Oh, interesting. So even certainly you can do more with voice training than surgery can.
Yeah, I think the idea behind it is that it's a shortcut, but you still do voice therapy before and after.
Mm-hmm. Yeah. And Bite Mark is here. First of all, Bite, I have a question for you. Oh no, what was the name of Sherwood Forest? Have you been to Sherwood Forest? Is that it?
I have.
Is that the right one?
Yes, it is. I have been to Sherwood Forest multiple times. I didn't go this year. This year was complicated, but I have been.
Yeah. So Bite's question is, what is your favorite poem?
Oh, well, I mean, that's probably the one I said earlier, the Dr. Seuss
one.
Oh,
those places you can go. Absolutely. Hey, you know what? That works. It's such a good one. So, okay. So Bite said, I haven't, but I'm familiar with Sherwood, and I have friends that go. I thought maybe it's one of my coworkers that has been there before. But it's real familiar. So, Bite, when we were talking about the books earlier, Tallulah was saying that, the places you go is the places you'll go. It's one of her favorite books. What is the impact to a person's mental health when they feel they are aligned in voice and identity versus being misaligned? And I guess that's kind of internal and external, right? But what's the impact to a person's mental health when that happens?
I mean, it's great. I think that being gender diverse tends to make somebody have a marginalized experience, because there is unfortunately a lot of discrimination in our society. And so I've just encountered a lot of this sort of like chronic fatigue, that having to constantly be going through life correcting people when they misgender you, just sort of like being on guard for your own safety, it can make it hard and people stop like speaking up and self-advocating, people it wears people down. And when you're starting to be gendered correctly, you don't have that burden on you. Plus, it just feels good to talk to people, and it really, it's like you're lighter.
Yeah. Yeah, that's really important. I mean, I think that a lot of, at least in my experience, a lot of people who haven't had that misalignment just don't even know. My 14-year-old is non-binary, and it's whenever they hear me correct someone in person when they say she instead of they, and I just poke a little they in there, just real quick, like you can see the relief in their face, and they're 14. Like that relief in their face when someone else is doing the work for them is amazing. So not even having to worry about the work and not do the work, that's got to be such a huge relief, and a huge just weight off of their shoulders, anyone's shoulders.
Yes, absolutely. I'm so glad to hear that you're supportive for your child.
Yeah, I mean, sometimes I don't support everything when they want to get acrylic paint on the floor, but no kidding. Well, so I also have a 7-year-old who is a living tornado, and he'll come through, and it's like I know when he's been home for more than 5 minutes because there's just a trail. Like I can track you to where you are, wherever you are in this house. I know exactly where you are because there's a trail. So can our voice affect our interactions with others on a daily basis? And if so, in what way?
Our voice absolutely affects people. So 95%-ish, like the majority of the message that we give isn't the words that we use. And having the message be given in a certain way can impact whether or not somebody actually stays and listens, whether or not they think that they know what it is that we're going to say, how they feel. We can just dump whatever we're experiencing in our voice on everybody, or we can gift them this voice that they feel good when they hear it. And a lot of that has to do with how effective we are. If I'm like, all right, you need to do this thing right now, it's really urgent, you might resist me, whereas, oh, okay, I need you to do this thing, it's really urgent, could you lend me a hand? And there's so many different choices we can make in how we communicate with people and the effect that we have with it.
That's interesting because my experience with those two inflections that you just did has been opposite. And maybe that's because I work in a male-dominated field. But if I use the sweet voice, the higher voice, I don't get as good of a response as if I use the mean voice. Like I have.
But you can be sweet and low too.
Well, oh, that's true. That's true.
Yeah, I would really appreciate if you could help me with this really quick. It would be really, really appreciated. Or like up high, could you help me with that? It would be really nice if you could help me with that. Politicians use, like, female politicians would use a lower pitched voice that's more monotone because it has the authority, like male-dominated field.
Yeah, I feel like that's more what I personally have to do. Because in my work life, it's like if you're not straight to the point, direct, the likelihood of it getting done is less. So is a lot of that driven by kind of the field that you're in, which way you want to go with that?
I definitely think so. So when I was working in nursing homes, I hadn't quite figured this out for my voice, and I mean, nursing is a very woman field, right? Like there were a few men there, but so yeah, when I used a sweeter voice, I was more effective because there wasn't that kind of resistance. But if I wanted to be seen with authority in a space that was more dominated by masculine voices, I would probably be seen with more authority if I did use, the monotone downdrift, a little bit lower pitch.
Yeah. And I guess maybe working in an assisted living facility, it's more personal, right? It's less about I need you to do something for me in a work way than I need you to do this for me in a personal way. So I think that's probably a big difference too.
Yeah, definitely. Each conversation, you have to be intentional about what you want, and if the more you're aware of how to change your voice the way you want it to be, the more you can have the impact and be heard the way you want.
Is it tiring to work on changing your voice based on each interaction, or does it just come naturally to you now?
I mean, I think that the process of changing someone's voice in your presentation can be tiring, and I think that you're learning to use your muscles in different ways and strengthening some of them. Um, and but our voice wants to be used, right? So it'll keep up. Um, yeah, I mean, I think it's a process. It is definitely something that takes work.
Yeah. Lady Lexi says, I'm a singer and I've noticed when I sing in my male voice now, I'm starting to have pain on the left side of my vocal cords. Could that be because my larynx is used to being raised now? And I will take a moment to just say, we are not here to diagnose. We are not here to do any medical advising. But that being said, Tallulah, if you are willing to generally speak on that, I think that would be okay.
Yeah, I mean, I think that anytime you have something happening different on one side than the other side, that's something to be attentive to. And if you are noticing that a behavior that you're using your voice for is resulting in strain, pain, fatigue, then that's where it's a really good idea to get some guidance from somebody who has more professional experience with the voice so they can help send you in a healthy direction of how to use your voice and have it be comfortable and maintainable.
That's great. Sea Bear, you for the trivia questions, you just got to type them in, and if it's the right answer, it'll give it to you. So what is voice therapy? What does a session of voice therapy, what's the layout of that? What does it look like?
So typically when I start working with someone, we first check in and make sure that their voice is healthy, and then we figure out what voice recipe they're using now, and modeling with my own voice what voice recipe they would like to have, and compare, find the differences, and then through training work one by one on all of those variables that there is a mismatch with, getting them. So if you want to do this, like what is the range for this variable, you are now able to produce it. What amount of it do you like to have on average? Let's get that consistent where each time it's the same, then have the feeling be the same, because you can't really think about your sound and think about what you're saying at the same time, and then generalize that so that you have not only that feeling all the time, but you stop having to think about it because it's now part of your voice recipe that you use.
And that's great. Do you have specific exercises that you do if they're trying to achieve something higher or something lower? Do those differ greatly?
Yeah, I mean, depending on what it is that you're wanting to work on depends on what it is. So I view it as kind of like a toolbox, and we have all these different things, and we'll just keep going through ways to adjust a thing until you get it, and then we stick with that one, and then if you need more tools. But it's ultimately about getting you to the voice that you want, and so we'll focus in. I also like to think about voice gender presentation as a bucket full of rocks, that there's all these different pieces to our voice, right? And if they were all rocks, you'd put them in a bucket, but some of those rocks are a lot bigger, and so we can get a lot more impact and change in our voice gender with working on the bigger rocks versus little ones. And so when I work with people, we start with the big rocks that matter to them and go in smaller and smaller rocks until, they're good, which could be like we're filling it with pebbles and it takes a long time, or it could be like, oh, you know how to raise your larynx, you know how to thin your voice, we're good.
No, that's great. So can you give us an explanation of how the voice itself actually works? I mean, you referred to it as the instrument, so kind of take us through that instrument that we have and kind of some examples of how that works.
Sure, I'd love to. So I like to use the power source filter window dressing framework when I think about voice gender. So power, that's the same for all of us. We have our breath, our posture, how we're anchored, how supportive we are, how we control our airflow. I know I see you like, oh, I should sit up. Yeah, so that supports our voice and powers it. And the more control we have, the more intentional we can be with how the sound quality comes out. And that's our power. Then we have the source of our sound. So if you put your hand on your throat You can feel the part that goes up and down. That's your voice box. And we make our sound from there. We have true vocal folds that vibrate. The tilt of the top cartilage can make our voice be really, really sweet or really vertical, really bored. This is so boring. We can have our voice be really constricted or really wide open to let the sound come out. We can have a very, very light voice or a really heavy voice that has a lot of weight to it. All of those things happen with the sound that we're making. And then we take that sound and we send it through our instrument. So if you think about a guitar or a cello, they have a fixed size and shape that's static, whereas our instrument is constantly moving and shifting. It's a really amazing instrument. And that size and shape, we do make smaller and larger with the way that we talk naturally, but with voice gender presentation, we can shift in general the size to be more in one direction or the other. And if we do, like, we are going to lower our larynx and have our throat be wide, our soft palate be high, everything be big and open, or jaw loose, we're going to get a much darker sound. And then if we raise our larynx up and we're going to add in narrowing in our throat and in nasal and together, and then everything's just going to get really, really small and get smaller and smaller and smaller until we just have this really, really tiny voice. That's resonance. It's our filter. We filtered our sound into being in a smaller or a larger cavity. And then we take all of that, right? Like, we made the sound, we shaped it, we amplified or dampened the harmonics to get the sound quality we want. And that is our voice gender presentation. But culturally, we can layer things on top of it to change how in our particular culture our sound is. So we can change what words we use, what accent. I'll be gone. That's just so lovely, ladies. We can change how we pronounce sounds. We can change our pitch, our intonation patterns, all of those things that culturally have meaning but aren't directly from our anatomy. And if our voice gender presentation matches what we want it to, we can use any sort of cultural overlay and have it still carry the voice gender presentation that we're going for.
That's really cool. The thing where you went from the deep to the high was almost like you had put a voice filter and you were just turning it.
Knobs, yeah, they're like little knobs.
It was really cool. It was like you just had a knob and you were just turning that voice filter to high. That was great. I'm not the only one who adjusted their posture. See? It's not just me. Yeah, that was really cool. Bite said that was really cool. White Mage said love it. Yes. Yeah, absolutely. It's neat to think about the different ways that you can adjust your physical body to affect your voice, because we don't think about, our voice being this thing that comes from your physical body, or at least I don't. Maybe everybody else does, but I don't think about it that way. I just think, well, voice is voice, and I can do silly voices with my kids, or, when I sing, I can do different tones and hit different notes and whatever, but I don't think about it that way, So thinking about it as an instrument, it's really cool to kind of put all that together. It is really neat. It's really cool.
Yeah, I mean, our instrument is amazing. And sometimes I think thinking about our voice as an instrument can sort of make it easier to approach this work, because right, like, there isn't like, well, if my larynx is in this height position versus that's the female position or the male position. It's just, this makes me brighter, this makes me darker, what sound is right for me. And there's lots of different combinations that people would tend to code one gender or another, or not code at all a certain gender, not be sure. So we can find the combination that works for us. I didn't show you belting, which, hey, how you doing? That's another cool one that comes from your lower cartilage here. There's so much with the voice.
Yeah, that's really neat. I understand the physical changes being made, but hearing it was neat. Yeah, exactly. Yes, it was neat that example of it was really cool. So you mentioned smoking in particular. Well, actually, before I do that, my brain just popped a thought in there that now it's gone. Nope. Oh, I wanted to say, I appreciate that you're talking about it in terms of brighter and darker versus more masculine and more feminine. I think that that's really important, and especially if you're trying to achieve something neutral, or you just want to have a bright, like, you just want to change the way your voice sounds legit because you just want to change the way your voice sounds. I like that term of it being brighter or darker versus more masculine or more feminine, because, like I said, in my personal experience, I have to use one voice at work and a different voice with my kids and a different voice, but I don't think about it that way necessarily, but it's brighter with my kids, and it's a little bit darker whenever it's at work. So I appreciate that you put it that way, for sure.
Yeah, there's a lot of different terms. The important thing is what sounds right, what fits with you. I think that there's a place for using masculine, non-binary, androgynous, feminine, because people do perceive those things, and certain combinations are more likely to get coded a certain gender than another. But we're not shifting between a masculine, right? Like if you think about what I did earlier, if I was going to make everything as hyper feminine, if that was the direction we were heading, I'd sound like I was a little tiny girl, and that's not right. So we found that balance that works for us, and people will continue, unfortunately, in our society to code things binary, but ultimately the sound quality that we like is the perfect voice for us.
Yeah, that's a really, really really good way to put it. It's almost just profound to think about it that way. And I think a lot of people don't consider that. I know I really hadn't before. So you mentioned smoking and that not being good for your voice. Are there other habits that you either encourage clients to start doing or encourage them to stop doing to support voice training?
Hydration is really important to this process. So if you think about the lining on the inside of our mouth, that lines our vocal folds, and pitch is how many times they're touching, right, in this wave per second. So 150, 250 times per second, the surface on the inside of your mouth touches. And imagine if it wasn't moist. Yeah, right? Like you could hurt your voice. And so that's one of the biggest things that we can do to keep our voice healthy through the process of using it every day, whether or not we're doing voice practice or not, is just to stay hydrated. Water is great if you're doing things that are dehydrating, like drinking alcohol or caffeine, exercising, being aware, and adding extra water as needed. We can also, if you're having hydration problems, you can hydrate from the outside. Some people who I've worked with have had really good luck sleeping with humidifiers in their bedrooms if they're kind of struggling with their environment being dry, for example. That can help. So, but yeah, I think hydration is super important. Vocal health in general. Another one that comes up a lot is reflux, that if you're having acid from your stomach come up and irritate your vocal folds, getting that under control so that you keep your acid down where you want it, down low, really helps a lot.
Yeah. This is making me want some hot tea. Absolutely. Listen, I need to hang out with you a lot because you're like talking about posture and you like drink your water. And this is good. This would be great. So YMH says, in your experiences, have you found age to be a limiting factor in achieving your ideal voice? That is a lovely question.
I don't think that there's any limit to age, but I think that voices are aged. So if you want your voice to be perceived as, when they hear it and they see it, that the voice's age matches the age that you present as, then there are things that you want to do. If you sound like someone who's a very different age than you, that's going to catch their ear. And I find a lot of this work is actually the opposite. Like they want to uncatch people's ear. They want to just have the voice sort of seem natural and blend in. So definitely there are limits if you want it to kind of correlate, but there is no age at which you can't change your voice. I think there's probably a bottom limit that if you are kind of not at the point that you're ready to do the practice and commit, I think 11 is about the bottom of where I found that it's possible. You know, if your child is 8, then maybe their voice hasn't shifted yet anyways, right? But yeah, that would be the main limiter, I think, would be too young.
Yeah, unless you're trying to get my 7-year-old to make funny voices consistently, I can't see him, if he was wanting to change his voice, I can't see him practicing every day. Now, that's not to say he doesn't already do voices. He has Tourette's, but not coprolalia, so he doesn't have words, but he has lots of noises and everything. And even that, like even having to deal with the strategies around that, it's hard to get him consistent on that. And that's something that can really impact his quality of life. So something that's maybe would impact a quality of life of a 7-year-old but that is optional. It's like keeping your room clean. It's just really hard.
Yeah, I mean, I've worked in the schools, so I have a concept of speech therapy. I think I found it to be like 50% entertainment, 50% structured with kids.
That's a good balance. For sure. Yeah. I mean, it's hard. It's hard to get kids to focus. But then I think about my 14-year-old, and they could, if they were wanting to change their voice, that's something that they could focus on, and they would be willing to focus on if it was important enough to them. So I'm trying to think about when they were 11 or when my older kids were 11. That's probably about in my experience, in my opinion, it's probably about the right age. If it's something is important to them, that's when they're willing to practice it on their own.
Yeah, that's definitely, and I think it's very individual, right? Like there are adults who cannot focus on the practice, so it's not always age driven.
Feeling called out right now.
Oh, no, that wasn't what I meant. But I think, right, like it's important to have strategies to make it easier, and not every practice needs to be sit down, do a drill. So I think being flexible and finding creative ways to practice. I like water, the idea that if you're having trouble practicing, just use your voice tools, what you're practicing every time water touches your body. If you're washing your hands, you're not really doing anything else anyways, right?
True. Unless you're trying to brush your teeth at the same time, which would be just awkward and weird.
Yeah, okay, that's one I hadn't thought of.
So what are some of the voice exercises that you use for deepening your voice, and what are some of the voice exercises you use for lifting your voice, just generally speaking?
So when I hear you say those words, what I hear are dark and bright, I think is what you're referring to, the size of our instrument. Yeah. A kind of fun way to explore the height of our larynx, which has it's the biggest stone for how bright or dark our instrument is. It shortens or lengthens our vocal tract, our tube that our voice goes through. We can yawn and like lower our larynx, then talk into the yawn. Oh, my larynx is very low. Or we can do a high silent E to make our larynx go higher, and have our larynx be in a higher position, and then yawn into a really low position and kind of explore height that way.
I feel like I need to yawn now.
You can't. I mean, if you don't yawn, I will be impressed, because you started thinking about it.
I know I did. I started thinking about yawning. Lady Lexi says, my biggest problem is shyness when changing my voice. It makes me feel like such an imposter and embarrasses me badly. I'll just say, I suffer from imposter syndrome myself in my daily life, and so I know the struggle there, but I'll let Tallulah kind of address that when it comes to your voice and practicing the voice that you're trying to achieve.
There are so many different ways that all of us sort of experience imposter syndrome, unfortunately. But I think it has its place in voice training, that you sort of navigate around it. Something that can be incredibly helpful is community, finding somebody, whether it's somebody that you know that you can trust to record a voice sample and send it to them and get feedback, or it's somebody who's also practicing their voice and they want to practice with you. Having safe people to practice with is hugely helpful. And I think that sometimes if it's not abstract, it can be easier. So if you are comfortable recording your own voice and listening back, when we hear our voice through our ears without it being a recording, it goes through our bones, and that sound is actually different than what other people hear. Whereas when we have a voice recording or a voice, that is the same as the sound, I mean, a little electronic, but it's the sound that other people hear. So that gives us a more true representation of our sound. And so in that process, sometimes when you hear yourself, you can say, oh, I thought that sounded bad, or I thought that sounded fake, but then you're like, okay, this is heading in a good direction. And then also sometimes it helps not to judge it as like, oh, did that sound like a woman, or is it fake? Or more like, was that, when I did it this way, brighter, or when I did it that way, was it brighter? Okay, can I consistently keep my sound brighter? Can I do this each time? And that sometimes not focusing on the big picture, but just the piece that you're working on can help. That's a good question.
Yeah, I like the not focusing on the big picture for a little bit, because sometimes you get too lost in the big picture. When you look at something as a whole, it's daunting, right? Like just making any sort of change is that way. It's uncomfortable to look at the whole thing and say, oh shit, I have so much work to do still. Where if you look at the tiny little steps, and I do this, everything's about my kids. I do this with my 7-year-old all the time because I'm like, all right, let's pick up all the dinosaurs right now, because if I tell him go clean his room, he's going to go, there's no way I can clean my whole room by myself. I can't do it. It's impossible. But if I tell him, let's pick up all the stuffed animals, then he's on it and he gets it done in a couple minutes. I'm like, cool, now all the Legos. And so breaking it down into that little step and just focusing on that little step, I think is really helpful in a lot of things in life, but especially if you're experiencing that imposter syndrome, if you're focusing on the little things and evaluating yourself honestly and openly, and even having someone else evaluate you also is really, that's a really good tip.
Yeah, I do. I had another thought. So something that I think relates to everything is we think about ourselves way more than anybody else does, right? Like everybody thinks about themselves. And so when you're going along and you're like, oh, did that sound right? The other person who's talking to you doesn't think that way. They're thinking about their own world. And well, it wasn't, did your voice sound feminine when you asked for the baked potato? It was, they want the baked potato. And so sometimes if you have a mantra, something like the only one judging my voice is me, or I'll make the best voice I can, and it'll just keep getting better. Whatever it is that works for you. Here and now I use my voice and try to every time have it be a start new. No one else is judging. It's just your best attempt in this moment and move forward. I think that can sometimes make it easier to practice actually using your voice that you prefer when you're out and about.
That's fantastic. Aside from gender affirming with voice therapy, are there instances, and we've talked about it a little bit already, but where someone might want to change their voice either situationally or more, oh my gosh, my words have just failed me completely, or more constantly or consistently? I was torn between those two words.
Yeah, no, I mean, there are tons of ways that people can change their voice that aren't her voice gender presentation. It's just the same set of skills. So if you're in your workplace and, right, like you gave an example where you're working in a field that's dominated by people using masculine voice patterns, and if someone came in and they really wanted to be promoted into leadership, but they had a voice just like this, and this wasn't really getting them, even though they were really smart, like this wasn't really getting them where they wanted to go, then they might want to use less pitch rises, to have their voice be a little bit lower. I know in the 1970s, when there was the movement for women to enter the workplace professionally, the average pitch of someone using a feminine voice went down an octave because everyone adjusted to the male-dominated field and wanted to be taken seriously. Lovely gendered stereotypes in our society. Wow. But yeah, there's presentations. If you're wanting to be effective, they have lots of, it's not as common these days, but when you listen to really good speakers, they've trained in how to be effective and different techniques to use with their voice. And so if you're giving presentations and you want to be listened to and impactful, you can learn techniques, right? Our voice is so powerful a tool, and I think that everyone is served by working on it and sort of gaining ownership of their sound.
Yeah. Do you have a lot of people come to you for changing their accent, either removing their accent or to, I guess, have you had anyone wanting to obtain an accent at any point?
Yes, so I have certainly had, okay, so we all have accents.
Yeah,
it's
true.
Even people who, like, if you think of, it's unaccented, that generally means the like Midwest accent is what our American society tends to think of as unaccented speech, but everyone everywhere has an accent. Mm-hmm. And you can use other accents. You have to learn them if you want to sound different, but you can. For within this work, I have had both directions. I've had people who wanted to lose a Southern accent that they gained to feminize their voice and gain a Southern accent that they associate with sounding feminine.
Interesting.
British also. That's another one that people have wanted to gain.
British now, is British traditionally considered more masculine or feminine, or is it just for the intrigue if you're not British?
I mean, I think that some people associate a certain sound with their goal voice and possibly gendering it, but I don't think that any culture's accent is inherently gendered because there's both, right?
Mhm.
There's masculine and feminine voices using every accent.
Yeah, that I mean that's very true. So I went to Australia several years ago now, but I was there for 3 months for work. And when I was there, I would have people just be like, oh my gosh, I'm fascinated by your accent. And I'm like, look, if you were in the States, everyone would be fascinated with your accent. And every time I go visit any of my family in East Texas, I come back with the thick, thick, thick East Texas accent. And then I have to like eventually drop it back out because I don't like it that much. And so I know that I have an accent, but I don't think about having one. So it's good to remind everyone that yes, actually everybody does have an accent. Bite Mark asks, my words are just awful today. Are you as fascinated by Eric Singer's YouTube videos as I am? He's a dialect coach that does stuff for Wired, and I personally love his videos.
I don't know that I've seen it.
So if you haven't checked him out, he's really fantastic, and he does a lot of how to make the sounds videos with his instrument, which he doesn't call it an instrument, but he talks about this is what's making that sound happen. This is what's making that sound happen. This is where that came from. This is where that came from. It's really, really cool. And highly suggest if you are interested in YouTube and getting down into a rabbit hole that you check his out. So it's Eric with a K, Singer, just Singer straight that way. They recently did a tour of USA accents. Oh, cool. Okay, I haven't seen that one. I'll have to check it out.
I will look it up. Thank you for the
Yeah.
recommendation.
Bite, you're welcome to link. I don't know if he has a sub page on Wired or anything like that, like a subsect of the Wired page that's just his stuff. I don't know. If you have a link, please post it. So do men or women benefit more in the workplace from modifying their voices? Like, is it more likely that a male identifying person would benefit versus a female presenting person would benefit by modifying their voices to be one way or the other? We talked about whenever women were entering the workforce, but what about now? Is it any different now?
I think the gender is less important than the level of discord there is between what the sound currently is and what the desired sound is. And sometimes it can go along with your background. I've had people who were neurodivergent who had a very high-pitched voice that they didn't think that they could change, and we worked on that, and so it wasn't a big shift, but once they were able to have just a little bit lower larynx position, then their pitch dropped a little bit and it sounded a little bit more like what they wanted to sound like. I think some people like to have voices that are different gender presentations to use at work for different situations. If you have the nice little old lady come in, you can have the really sweet voice, I'll hold your hand, everything's fine. And then if you have the big football players, you might want like, hey dudes, how you doing? You might want a much tougher voice, and being able to shift is helpful. It's really, like what voice resonates with you, what voice do you hear in your head, what sound qualities do you like. It's so individual and it can change over time. And I think that everyone benefits from being intentional with their voice if there's any sort of discord or less effectiveness than they would like.
Do you work with clients on word choice in addition to delivery of those words at all?
So I will, if it's a goal for a client. There are things like adding tag questions or indirect versus direct language that can be used. I find that most people come to me for their voice, and so that's the focus. And that tends to be, if it's something we're talking about, it tends to come up later and more briefer, because if your voice sounds right, you can use any words, right?
That's true. That is a good point. Is there such a thing as voice discrimination? And if so, who is most at risk for that?
Unfortunately, there is. We've had a lot of conversation right now about the workplace, and there's a lot that goes on in the workplace that people will get discriminated against on their sound, also gender presentation, and in general. We all know about the salary mismatch between men and women, like 75 cents to a dollar, I think. But yeah, no, I think that there are many different situations in which there can be voice discrimination, all of which we should get rid of. People risk harm if their gender expression doesn't match their voice gender expression, right? If you're going along and somebody clocks you, that has led, unfortunately and horribly, to situations where people have been harmed. In hospitals, you're trying to get care from doctors who don't know you, and maybe it's not your voice gender, maybe it's that you have a communication disorder and you aren't as clear speaking, or you're disfluent, or you have Tourette's and you say words, and so then somebody talks to someone else like you're not even there, and you're not being able to make your own medical decisions, or because you have the presentation that makes people question that is your intellect the same as everyone else's. Maybe they devalue your quality of life and deprive you of life-saving care. Yes, I mean, it's a big thing. It's not something that should be there, but I think bringing awareness to it helps, because any time that we can hear somebody and we realize that it's affecting how we're reacting to them in a way that isn't what they're intending, then we can focus in on the words that they're saying, and that can help kind of break through some of that.
Yeah, it's such a big thing that I think, there's a lot of things in the world right now that get talked about as far as discrimination go. They all need work, and I wish none of them were there. I wish we could all just treat each other as humans. But it's frustrating. It's frustrating for a lot of people to go through all of that, especially when you're going to see the doctor or something. That hits home for me, because a lot of the times I go in with my kids, and fortunately we've got great doctors now, but there have definitely been instances in the past where we had to go through some bad doctors to get to the good ones, and it's hard to see that kind of discrimination hit so close to home, for sure. Thank you for that link, Bite. She just sent the I'll send this to you after. Let me copy that so I don't forget. She sent part 1 of the US tour. I'll have to watch it also. For sure. If you weren't doing what you do now, or if you had chosen a different path, what would you be doing instead?
So prior to when I decided to start my private practice, I had wanted to get a second master's in public health administration. My little sister is very inspiring to me. She went back to school and did that, and then she started working for the city of Durham, and she's been helping them make their homeless services be more in line with the housing first concept and low barrier shelter access, and a lot of things that have made a big impact in their city with making there be less homeless people and higher quality of life for people who are struggling with housing. And for me, healthcare access and healthcare being fair and equal to all are really big issues. I really like problem solving systems approaches, so I had that drive to go in and do that. I think I'm really happy with where I am now, and maybe I think more getting my voice out there and getting people to hear and figure out ways that they can make healthcare more accessible versus like going back to school is I really like what I do. It is a lot of fun and really practical to help people with their voice.
Yeah. So you're just surrounded by really inspiring people. Sounds like.
I try. I mean, right? Like they say that the people that you surround yourself with are the people that you're like. And so if you surround yourself with people who are working and making the world a better place, you yourself are more likely to be working on it as well.
I love that. Also, I'm realizing I'm in trouble. No.
Well, you know
No.
me now, so
Yes. See, there you go. Listen, you're going to get me to sit up straight and drink my water, and that's great. Fiona sent this question in ahead of time. What is your day-to-day experience like as a voice therapist, and what was your experience like when you were training to become one?
those are very different things. So now things are pretty chill. I get up in the morning, I do my little internet check on all my social media, and then I do one-on-one conversations with people where we work on their voice, spend an hour with you, and then you eat, do a little paperwork and billing, mostly just talking to people. Graduate school is a whole nother ball game. It's like, okay, like we're going to plan for this session. We're going to have the 2-page plan approved and talk about it. And then we're going to go do our hour-long session. And then we're going to spend an hour writing up a 2-page note about what we did during the session, and spend an hour talking to the clinician who supervised us about it, and for every single session and all the many, many different areas that the field of speech therapy encompasses. We're working on swallowing, or little kids with speech disorders, or their voices, or communication devices, right? This huge field that we have. And every time you go through that process, you start to learn, and each person you learn something different with. But it is a different world, right? Like you have to kind of get comfortable with being able to talk to people about uncomfortable topics, and how to present things in a way that's effective, how to teach in a way that people hear and learn. And so it's a heavy, intense process. Now this is a little later.
Yeah. Yeah. Was it worth it to you?
Yeah, absolutely. I absolutely love what I do.
Yeah. We've heard several times that grad school is just awful and not fun and not ideal. But that almost everyone that we've talked to, well, I won't even say almost everyone that we've talked to on here loves what they do. They don't always like the bureaucracy, paperwork, those kinds of things, the background, the red tape to do their jobs or whatever. But everyone we've talked to on here just absolutely loves what they do. So it seems like it's worth it.
Yeah, I think helpers are driven to helping fields where they can help people. But I really do like what I do. And grad school is one of the hardest things that I have ever had to do. But I couldn't have gained the level of clinical skill to be able to help people as strategically and effectively if I hadn't had my years of and let's write that 3 more times, and let's do that 6 other ways.
Was there anything in grad school that you wish you did get to do more of now?
Well, I think doing more gender affirming voice training in grad school would have been awesome at the time that I went. There wasn't a lot of it. Great voice program, but that hadn't worked its way in as deeply. I think it would have been nice to have a placement in an ENT's office. I went to a hospital instead. But I did a lot of AAC in grad school. I really like with communication devices, giving people voices who don't have them. And that was a big focus in grad school for me.
That's pretty cool.
I had a pretty good grad school experience. I got to I think I had 31 placements during my time there. They kept me busy.
Yeah. Yeah. Were you just going to grad school? Was that your total focus?
I had not an externship. I don't remember what it's called. It's been so long, but there's a job that you have where you work for doing research. Research assistant. I had a research assistant
there you
job.
go.
There we go.
Yeah, I worked full time as a single mother while going and getting my bachelor's. I only got my bachelor's. I didn't go any higher than that. But looking back at that now, first of all, I'm glad I was young, because if I tried to do that now, it would be a different story. But second of all, to me, it was worth it. But I know a lot of people who have gone to school not for anything related to, voice training or anything like that. Nothing in that kind of realm. Honestly, nothing in the medical realm at all, or healthcare realm, really. Everyone seems to feel like their schooling was worth it for that. But I was a business management and marketing major. And I know a lot of business majors who don't feel like it was worth it, except for you have to have it for your resume. That's it. You got to have it.
I have a good friend who her path out of the nursing homes was to go get a master's in business. She used to work with me and she left and she's been really happy there. So my path to school is very indirect. I was not a big fan of school when I was younger. I think kids weren't very nice. I mean, it's kind of hard to imagine, but um, they I didn't finish high school, so and much to my parents' chagrin, but I went on and I have 3 degrees from college now, so I think it all worked out.
Yeah. I mean, no matter what path you take, right? Eventually you're going to wind up with something that you enjoy doing. Hopefully, that's the goal,
Yes.
right? As an adult, that's what you're hoping for, is that you wind up in a career that you enjoy. So you got there. That's great.
Yeah, I think there should be more focus when we consider education or even anything we do on what we want our end job to be, rather than like there is value in the process of getting educated, but I think that if people spend time thinking about maybe follow somebody doing what it is that they're thinking of doing, is that what I want to do? Do I want to be in a computer? Do I want to be helping people direct whatever components that you want to the job, and then finding the path to get there and using education as a tool to get there, I
Yeah.
think makes it be much more useful.
Yeah, definitely. So we have come to the magic moment of the stream, and I'm getting my magic wand because yes, I do have one, courtesy of Bite Mark, and I'm gonna change it a little bit here, but I'm gonna wave this magic wand, and with this magic wand, you get to tell me what, if you had the power, you would eliminate as far as one common opinion, misconception, theory surrounding mental illness, disabilities, or talking about mental health. What is that going to be? And hopefully this works. This hasn't broken. So here's the magic wand. I'm just going to wave it here. And now you have the power.
Oh, well, I would want everyone to know that it's possible to change their voice gender presentation. I think that's a pretty core message, that people should know that they're able. A bigger message is that everyone has quality of life, and that no matter what sort of barrier they face, whether it's a communication disorder or a physical disability, that everyone has the right to the same health care. Maybe their gender expression and the sex on their driver's license doesn't match. They still need health care, and that all of that access should be equal.
That's a big one. All of that access should be equal. Did y'all hear that? Please, somebody put that in the universe and say all that access needs to be equal right now. That's a big one. Well, I'm going to open it up. If there's any remaining community questions, please put them into the chat. And I'm just going to open it up to you and say, is there anything we didn't talk about as far as voice therapy or resources or sites or anything like that? I do have your links. I'll post them again. And then I'll just open the floor to you.
Oh, thank you. So I know for people who are working on changing their voice gender presentation, having community helps a lot. I did include the link to my Facebook community where you can come together with other people, come to our group, and then I don't know. I think everyone should know that it's possible to change their voice. I think that it's so fulfilling, whether or not it's for voice gender presentation, for effectiveness, for having a sound quality that resonates with you. It's possible. There's a lot of resources out there. I'm happy to help people guide whatever direction that they want to go, whether it's helping others. I like teaching people how to teach people. That one I particularly like. Impact more people that way. But yeah, no, I think that, I see Trans Refuge being recommended. That is an awesome site. So first of all, they have a whole bunch of really cool people in Australia that are really, really nice that I like.
Hey!
But yeah, Trans Refuge is a great space. It's very inclusive, and they have meetups on Friday and Saturday nights where people can come and meet with community. And for my group, we're having a meetup this Thursday at 6 p.m. Central Time, I believe it is. And it is through the Facebook groups. If you want to go there, you can also email me and I can get you connected as well. But yeah, no, I really appreciate you giving me the opportunity to come here and talk about my favorite subject. It's been fantastic.
Yeah, I'm glad you were here. And Lady Lexi, thank you for that link. I appreciate it. I haven't seen that website before. But if y'all are both recommending it, I mean, Can't be bad, right?
It's kind of like Facebook that's super open and welcoming that's targeted for people who are gender diverse.
So it's the anti-Facebook.
It's a social media. There's a lot of them.
Gotcha. Understood. Facebook has turned into a giant dumpster fire in some areas. Not all of Facebook, but boy, I'm from Texas and my family is from Texas, and not all of them are great. I'll put it
and a lot of
the people. Yes, I have a lot of them mute. Like I mute them so that I don't have to see their posts. They still wind up cropping up every now and then though, but for sure. Bite Mark said, thank you so much for being here. This whole interview was fascinating, and I echo that. This was a fantastic conversation.
Yeah, thank you so much for reaching out to me. I've really enjoyed talking and meeting you and your audience.
Yeah, absolutely.